Hello everyone, this is Edye Godden and I am one of the certified riding instructors at HETRA, and today we are presenting about horse emergencies. And as we talked about, I've got you guys on the chat box, so if you have questions as we go along, please holler. We are going to be going back and forth between our slideshow a little bit as well as our some YouTube videos that show some things. So, and again, we'll stop here at the end and ask for additional questions if you have them as we go along. All right. So, horse emergencies, when to panic. And I say that because we need to make sure that we never panic in a horse emergency, and that's extremely important. The calmer that we can stay, the calmer we can keep the horse and the other people in the environment, the safer that we can keep everybody coming along. So try not to panic, even though you might feel that internal panic. It's important to try to keep your head about you and make sure you're thinking through every step you take. So we're going to talk about several different horse emergency situations and what's the best way to handle those situations. And as we talk through those, we will talk through the details. But important things to keep in mind always. Number one, keep yourself and others in the area safe. Your personal safety is most important above everything. So make sure you keep yourself and anybody else in the area safe. Call for help early and do not intervene if you are not qualified. So if you feel like the situation really needs somebody or needs multiple people to deal with it, as hard as it is at times, sometimes you have to stand back and just try to wait for that help to arrive before you can do anything. And then the last part is that we need to make sure that we get that vet called as soon as it's deemed needed, and that you have as much of the information you can prior to making this call. So the vet's going to ask us a lot of questions about what's happening. It helps them to determine how much of an emergency we have, how quickly they need to arrive, and also to allow them to tell us what things that we might need to do as we go along. All right, so the first situation we're going to talk about is a horse getting cast in a stall. And some of you guys may have seen this at HETRA. I think we've had it happen a few times. And this happens when a horse lays down and rolls in their stall and they end up too close to the wall and they actually get stuck. So their feet get stuck and they're unable to right themselves. And horses get cast for a variety of reasons. So they might not be feeling well or might be colicky. There might be fresh shavings in the stall and it just feels really good to roll. They might have flies or insects that are really bothering them. So there's a variety of reasons that they'll do that. And also, sometimes if we give them just a little bit of time, we find that they will get themselves righted. So sometimes time alone, we don't need to intervene. They will get themselves righted. But if we do come into the barn and we find a horse that's rolled up against a wall, their feet are obviously stuck against the wall, it doesn't appear that they can get themselves up, that's when we need to think about what are our next steps. Oops, and I clicked too far. All right, so here we're going to try and see if we can play a video here. We're going to see how well I do with all of this stuff. And of course, it's not playing on the right screen. So hang tight. I'm going to pull this over to this screen here for us. All right, so this is actually going to be a video of a horse that's cast in a stall. And we're going to be showing, the gentleman is going to be showing how he gets the horse up. And we're going to be talking through the process just a little bit more. So we're going to go ahead and play that. And I wish I had some sound with that so we can talk through it. So hang tight 1 second here. some reason my, we're going to pause that and back it back up again. And hopefully here we're going to hear some sound. All right, here, let's try again. Play it. We're going to go to full screen.
Oh, come on. I think I need to come and help you.
Okay, so I think that was a great video that shows what happens when a horse gets cast in a stall. And it really shows how calm the gentleman was to help get that horse up and what had to happen if somebody did have to intervene in that. And again, just to remind you guys, if you guys have questions, please use the chat box, which is the bubble there, and use that chat box and send me some questions. So when a horse is cast in the stall, the first thing again is to keep yourself and others safe at all times and to remain calm. So you heard him talking quietly. He was moving calmly around the horse. If you're alone, make sure you call for qualified help. So this is not a situation where you want somebody with no horse experience in there with you, because you want to be able to get out of the way quickly if you need to. You need to kind of anticipate what that horse is going to do next. You want to find 2 long lead ropes, and you're going to wrap the lead ropes around the legs furthest. And again, you want to be very careful in that process. So you can see it would be very easy to get kicked by a hind leg. If the horse starts to panic, they might start to push themselves and thrash around. You want to begin to pull the horse towards you. And you want to make sure as you do this process that you have a quick exit from the stall. Because once that horse gets rolled over, he's going to try to quickly come to his feet. So once they hit that midpoint and comes towards you, you want to calmly but quickly leave the area. And again, at some point, they might be able to push themselves away. If they do, that's fine. Just let them get up on their own. Once they're up, you're going to remove, obviously, the leg wrap or the lead ropes. And then you're going to assess them, maybe take them for a short walk. And in our case, you would notify the horse manager to let them know what happened, and so that they can keep a close eye on the horse to make sure that we don't have something else going on. Oh, you guys didn't see any of the video? Yes, no video? Okay.
No video.
No video. A couple people could see it, but not everybody could see it. Is that the case?
Yes.
Okay.
I saw it.
I saw the video.
Okay.
I did not.
Okay, so for those of you that weren't able to see the video, I will have this link for you, and I will send it to you so that you can watch it down the road. When we go to play the next one, again, let me know if through the chat box if you can, whether or not you see the video or not. Okay, so we talked about horse cast in a stall. Next thing we're going to talk about colic, and we mentioned that a little bit, that could be a reason that a horse does get cast in the stall is that they're colicky or they have a stomach ache. And the signs of colic, a lot of you guys know these already, is that the horse might be off feed. So you might come in and notice that they haven't eaten all their hay or they haven't eaten their grain. They might be pawing the ground repeatedly. They might be looking at their belly or at their back. They might be laying down and won't get up. They might be laying down and getting up frequently. They might be rolling around on the ground, and they might be curling their lip up and outward at us in kind of a pain response. So what do we want to do if we think that the horse is colicking? There's several things we want to do. We want to first notify the horse manager here at HETRA immediately that situation is happening. If you are a qualified horse leader, we want you, and qualified to lead that horse, we want you to remove that horse from the group if they're in a group setting. And then we want to remove any feed from the area. So we don't want to take them out of the group setting and then put them back in a stall where they have food that they could eat. Because sometimes if their tummy gets feeling a little bit better, they'll start to eat, and then we add to that impaction or to the problem we're already having. So we're going to talk a little bit about vital signs and temperatures. If you are qualified, you will want to take their vital signs and temperature before we do anything else, because that is something that the vet is going to ask us. What is their temperature and what is their heart rate? And then we might want to walk them. But again, we're not going to walk them excessively. We want to just try to move them around a little bit to help get their GI tract moving a little bit more. And if they'll lay down comfortably and quiet, we can let them lay down for periods of time, but we don't want them to lay down and roll and thrash. If a horse is in significant pain, you might not be able to stop that. And again, your safety is the first thing that we always take into consideration. We might administer a pain medication if we're told to do so by the horse manager, and they're going to be getting guidance from the vet on whether or not to do that. We want to make sure they have access to clean water, and we want to monitor them for the passing of gas and manure. So part of that process means that we're going to clean up any manure in the area so that anything new can be evaluated. And then that horse is going to be not given any additional feed until we've gotten permission by the horse manager to do so. And again, they're going to be doing that under the guidance of the vet. So we're going to look at another video, and I'm hoping you guys can see the video this time. We'll see if it pulls up on this page. Nope, it's going to pull up over here.
So what are the signs?
So hang up 1 second for me.
Horses with colic typically.
I'm going to get better at this, I promise. Okay, I'm going to put it over here. Or not. Okay, we're going to try that again. Okay. This again. Over here. And we're going to go to full screen. And can everybody see that on the screen? Can everybody see a horse in the middle of their screen? If you guys can just type in the box, you can see it. Yes? Okay, good. Okay. And hopefully you can hear it as well. I'm going to go ahead and play it now.
They become distracted. They start flank watch. They can roll on the ground. And they can show a whole lot of signs of abdominal pain. So this horse here in the picture is having a look around at his flank, and he's trying to tell the owner he's got a painful abdomen. Horses with more severe types of colic may be rolling on the ground. You may not even be able to stop them. This is another young horse showing signs of colic. he's in the hospital with a drip tube attached, but he's pawing the ground continuously and is in a considerable degree of pain. And this is another horse in the hospital who's actually trying to roll on the ground. This is despite administration of painkillers. This horse is quite painful and is trying to get down and roll, but we're not letting him do that because we're going to take him into surgery to try and help him out. The main thing an owner needs to understand with colic is when is it serious? When do you need to bring a horse to a hospital for more detailed treatment and investigation? This can be simplified. If a horse responds to a simple painkiller within 10, 15, 20 minutes of administration of the painkiller, then it is likely it is a relatively simple colic, such as a bit of a spasm of the intestine or a bit of indigestion, and that horse will most likely need no further treatment whatsoever.
All right, we're gonna go out of this one, close out of that, and go back here. Okay, so that showed just some good video of what a colicking horse actually looks like and the things that we need to watch for in the colicking horse. Oops, clicked too far again. So the next thing we're going to talk about is choke in the horse. And I don't know how many of you actually have heard of choke or seen choke. It is kind of scary when you see it happen. It does require some pretty immediate attention. And especially with some of our older guys, they are definitely at more risk for this type of thing. So a horse choke, and a lot of you guys I know help feed horses. So that's, of course, the time you're going to really probably see these things happen. They are eating, they stop eating, they start coughing, they stretch their neck, and they start shaking their head. And you might kind of see this on an occasional basis. Again, kind of like us, we swallowed something kind of wrong. We kind of cough it up and then we go on. A choke situation goes on for a long period of time. The horse just really cannot clear that out of their esophagus. It doesn't interfere with their ability to breathe. If this happens, you want to remove all the food from the area because we don't want them consuming more and putting more of a problem in there. You want to watch for any nasal discharge, which might include small bits of food. It will usually subside on its own, but if it does not, it requires immediate vet attention. And you'll want to watch for signs of aspiration, which means that they might be taking small bits of fluid or food into their lung, which could cause infection. And again, we're going to watch a video here, and if I can get this going in the manner that I hope, maybe. We can get it up on the screen. I'm gonna move it over here. There we go. Can everybody see it?
Yes.
Okay,
Yes, I see it.
good. So this shows some of that nasal discharge that we talked about. And then there's that choking sound that he's making. It's obviously pretty uncomfortable. And that smiling they're talking about is when the lip actually comes up and forward, kind Kind of, they do that sometimes when they're colicky. So this is obviously a situation where they're waiting for the vet to come. I'm going to scoot it forward here just a little bit. And so this is the vet actually treating that situation. And I apologize, it does say graphic on it. I guess stuff like this doesn't bother me, so hopefully it doesn't bother you. I see Jessica asked to turn up I can't turn up the volume anymore, I don't think. So they're working on this horse to get this horse choke free, to get that blockage moved out. And so finally there at the end, they do get the blockage clear, thankfully for this horse, which is very, very good thing. All right, so we're going to go back to our slides here. And we're going to talk about lameness in the horse. So again, all of you guys are help with horses and know our horses on a very regular basis. And so when we look at lameness or a horse that's maybe not moving quite right, they look a little bit off, they might be limping. It could be, again, termed a little bit differently depending on who you're talking to. We have to determine a few things. Number one, is this a new problem or has it been a problem for the horse? So if it's a horse that you know has a known problem for some lameness problems, this might be an exacerbation of that. Or if this is something new, this horse you've never known to have a problem, then obviously that becomes more significant. We need to know, when did it come on? Were you watching this horse down in the turnout and they were running and playing and having a good time, and all of a sudden now they're holding up a leg and they won't put any weight on it? And that talks then about their weight bearing status. Are they putting full weight on that leg? Will they put full weight on that leg or will they not? We always want to obviously catch the horse and remove them if they're in a group environment if possible. We want to check the foot you suspect to make sure that there's nothing in a foot. And I had this happen to me a few months ago with a horse at home. We lifted the foot up and sure enough, there's a nail sticking out of the bottom of the foot. And we, of course, were flooded here last year. So we have some of those fun things in our soil. First thing we want to do is we don't want to remove that item from the foot, because we want to make sure that the vet is notified, and the vet may decide that they want to take an x-ray so that they can see exactly where that nail went and what structures were impacted. And that will tell us what our long-term prognosis is, as well as our long-term treatment. So if possible, don't remove the object from the foot. We're going to wait until the vet comes to do that. We obviously don't want to walk a horse any long distance with a nail in their foot. We want to kind of keep them calm and wait where we're at. If we don't see anything in the foot, we want to feel for any heat or swelling in the leg that we think is involved. We want to start up high and move down the leg, and we want to really feel, again, we might want to test one leg versus the other, or we might want to feel one horse's leg versus another horse. If you feel like both feet are warm, I would go feel another horse's feet to see, are they warmer than that horse's feet? If we have a horse that we call what we call three-legged lame, and it was a sudden onset and we have no significant heat or swelling, we might have an abscess that's occurred, or we might have a significant injury, a fracture or something that's occurred. So again, we want to not walk that horse any long distance. We want to notify the horse manager and the vet as quickly as possible so we can get treatment for that horse as quickly as we can. And then the other thing that we're going to look at in the horse, especially with our older horse population, is is that horse rocking back onto its back legs when he walks? So he's trying to rock back to take most of the weight off of his front legs. So horses bear more weight on their front legs than they do on their back legs. You'll notice horses will rest a back leg periodically in the daytime. A horse does not typically rest a front foot. If a horse is resting a front foot, it typically means that we have a more significant problem going on. All right, we're going to talk about cuts, scrapes, abrasions, bruises, and puncture wounds. Those things happen with our horses, unfortunately, and we just have to deal with them. And the important thing as we look at those is we have to evaluate it to determine exactly what needs to be done. So a lot of times a puncture wound will hide itself as initially as a scrape or a cut, and we won't actually see that it's punctured. A puncture wound is more difficult because we can get bacteria deeper into the tissue, and we want to treat that a little bit differently. So we want to know how deep it is. And again, we're not going to go poking around in there, but we are going to look at it and just try to assess what we can see without really doing a lot of palpating. We want to know where it is located and how close to a joint it is. So horses have a lot of joints in their body. They have a lot of joints in their legs. Their legs tend to be an area that does get cuts and scrapes. If we have a cut that's really close to a knee, we're not sure how deep it is. We're not sure if it might be a puncture. That's probably something we want to get a vet out to take a look at, because we want to make sure that what has happened is that we haven't punctured that joint, and with that joint getting a joint infection then. We want to know, is there fresh blood? So this is something that's happened really recently, and has it stopped bleeding? Is there other colored drainage? So is it something that looks yellow or pussy? Is there a smell to it? Is there swelling or heat into the surrounding tissue? Does it look like a big softball size fluid-filled sac? So occasionally we'll see a bruise or a hematoma, or a horse got kicked or ran into something and there's no outward appearance of an injury, but there's a big fluid-filled sac there. That's basically a giant bruise. Does it appear painful with gentle palpation around the area? So again, we don't want to go around poking around. We want to be very careful of our own safety. But we want to know, is it something that bothers them, or is it something that they really don't pay much attention to? And then the last question is, are they moving okay? Are they sound, and are they acting okay? And all of those things tell us what our next steps or next stages might be with that horse. All right, we're going to move on to the next one. So horse vital signs, and this is important again for everybody to know, because you might be the first one that comes upon this situation, or a horse that's not feeling great, or a horse that's been injured, or that may be getting sick. And so what we want to be able to know is what are normal vital signs for a horse. So a horse's temperature can be from 99 to 101. Their pulse is usually 28 to 44 beats per minute, and their respiration is 8 to 16 breaths per minute. Now, of course, if we have a horse that's been running around in the pasture, their respiration and their pulse is going to be much higher than that. And we want to give them time to bring those things down and then retake them. And then their mucous membranes. So if we lift their lip and we look at their gums, we want them to look moist, healthy, and pink in color. We also want to be able to look to see if we push on those gums, that they have what we call a good capillary refill, which means that that blood comes back to that area in a pretty quick manner. And again, we're going to try to watch another video here. And hopefully you guys can see it. I'm going to see if I can get any better volume. Oh, I muted it.
I'm Dr. Chad McGee today, here to discuss with you how to get vital signs in your horse. So vital
Oops, I lost it there for a second.
signs would be temperature, pulse, respiration. may hear some people refer to it as TPR. So temperature, that's pretty self-explanatory. We get rectal temperatures in horses. Don't be bashful with them. If you just put the little teeny tiny metal tip in, you're not going to get an accurate reading. Those of you guys have ever had a horse that's colicked or seen one that's colicked, we're not bashful. We put on a big sleeve, and it's a lot more invasive than that little thermometer. So don't worry about offending them too much. That being said, if you got a horse that's a known kicker or anything like that, don't risk getting hurt over it. It's not worth that. As far as getting a pulse on them, there's a number of places that you're actually able to get a pulse. So right here, where Wag's cheek meets his jaw here, see where the rope is falling right here. There's actually an artery that runs right here as well that you can feel that artery sometimes and get a pulse on that, especially if you got a horse that's pretty quiet and keeping his head still. It's pretty easy to, I shouldn't say pretty easy, it's not terribly difficult to do there, but if you got one that's just constantly bobbing his head around, it can be rather difficult and a little bit on the annoying side. Other places you can get it, you can also feel if they have an increased digital pulse, and it's pretty easy to feel. You can feel it by feeling the digital vein, artery, and nerve that runs down their fetlock right here. And they also have it on the inside of their fetlock right there as well. Probably the easiest and most reliable place to get a heart rate on them, though, is going to be if you have a stethoscope, listening right here, and actually putting the bell of the stethoscope right in underneath their elbow. Now, see how Wyatt's standing right here? He's kind of got that left front tucked back a little bit, and that'll make it pretty difficult in order to hear his heart rate. So a lot of times what I'll do is I'll have him do what Wyatt just did there for us now and step back a little bit so that he's got that left front out a little bit more. Then that way, the point of his elbow right here isn't actually blocking that window where you're able to hear his heart over his rib cage there. So, but don't be bashful. Actually take the bell of the stethoscope and wedge it right in underneath his elbow if you have to. Sometimes you'll get a little ticklish at first, but right there is where you're going to be able to hear it. Fish around a little bit for it in order to be able to hear it. It's a super useful piece of information to be able to get. You can give your vet a lot of information if you wind up in kind of an urgent situation and trying to help your vet figure out what's going on with your horse over the phone. The other piece of the TPR is respiration. So pretty easy to feel. I shouldn't say feel. Pretty easy to see just by looking at. You sit here and just watch their side for a little bit. You're able to see the excursion on their chest wall and tell when they're breathing in and out. Another thing you can do is just kind of let them get used to it a little bit, but if you have an arm kind of near their nose or something like that, you can feel them breathing on you. Sometimes you'll have to let them take a little bit because when you first put a hand on an arm there, a lot of times they're going to sniff it a little bit. So normal heart rate on them is anywhere from 36 to 42. Normal respiratory rate, anywhere from 12 to 16. And normal temp on them is anywhere from 99.5 to 101.5. That being said, I got a lot of horses that run down to the 98 range, and that's normal for them. So if your horse is one of those ones that's a little bit colder blooded, it's a good thing to know if he's sitting at like 101.1 or something like that. I might look at him a little bit with a little bit more skepticism of everything normal there. So anyways, hopefully that helps and helps you guys get some more information. Thanks again. Take care. Bye.
All right. So maybe I'm going to get back to where I need to be. And here we go. And so now I am going to go ahead and get everybody unmuted so that so that everybody can join in the conversation if they would like. I think I've unmuted everybody, but some people may still be choosing to be muted, and that's fine. If you're not unmuted and you want to ask a question, please send it through the chat, and I'll try to get it unmuted through there. All right, what questions do you have? No questions?
Hey, Edie.
Yes.
Unfortunately, I had to miss the first 10 or 15 minutes of the webinar.
Yes.
Will this be available as a recording?
Yes. Yes. So we will put it together as a recording, and it'll probably be posted yet, I would say probably by tomorrow.
Okay, awesome.
And those video links should be in there for those of you that couldn't see the videos. I think it's great to watch some of those videos, kind of see things in person. Anybody else have questions?
I actually had another one. Oh, I'm sorry, Sheila. Go ahead.
No, he's talking to the dog.
Edye, could you explain what actually happens during choke? Like, I remember like the different symptoms, but like, could you just explain again, like what physiologically causes choke?
Yeah, so basically what happens is something that they're eating gets stuck in their throat, or somewhere in their esophagus, down on its way down. So it might be that they have a problem with their teeth. They might be an older horse. You guys have probably seen horses spit out wads of hay, and those horses aren't chewing the hay well enough as they spit out that wad. But if they tried to swallow that wad, it might get stuck, and then it gets stuck in there, and stuff can't pass it. It's just stuck. And so at some point, you need veterinarian assistance in order to get that moved through there in order to help them. And I got it. See, we have one question from Carol, who's asking how the horses are doing right now. And the horses actually are all doing great. They are still doing some light conditioning type of activities to kind of keep themselves ready to go back to sessions as soon as we're able to. And they're getting regular turnout. And I think they're loving the nice weather. But I know they're also ready to get back to work. Our head horses tend to be those horses that like that people interaction, and they like activity, and certainly the last few weeks have been not that for them. So I know they're ready to get back to work. What else? Well, if there are no other questions, I did get a question on how Luna is. So for any of you that know, we did have a significant horse emergency happen at my house personally. Luna, who is one of our brood mares, after she delivered her baby, ended up with a colic situation. We found out that part of her colon was displaced. Thankfully, she has come through it and is doing great. She's back to full feed. We've got it spread out for the whole day, but she's doing great. But it took us a week, 3 to 5 days to really get her back up to that point. So sometimes colic situations can turn into something more. So we could have a gas colic, which means we've got a lot of buildup of gas in there. We can have an impaction colic, which means that the fecal material has impacted in there and can't pass. We can get a displacement, which is what happened with Luna, where part of the colon goes where it's not supposed to go. That sometimes happens after a mare foals because there's all of a sudden lots of room in there. So that colon can kind of slip to where it's not supposed to be. We can actually have a twist where the colon itself has twisted on itself. And those are pretty serious situations. And if you guys have any topics that you guys would like to hear more about, we would love to help everybody out and do some more of these and address what people want to hear. So please let us know. You can shoot us an email. You can respond to the Facebook when we get them out posted on Facebook, whatever. Please let us know.